So the injury happened at a company soccer tournament. It was a championship game about 2 minutes before halftime. I went up for a header and came down and something wasn't right.
26-year-old Taylor Bowman, an avid sportsman, had hoped the knee pain would go away. But when it didn't after a few days, he went to the doctor and got the bad news.
But when they told me ACL, I was pretty disappointed. I'm a big soccer player and a big skier, so hearing that was kind of the death knell of the knee, and I knew I'd have to do something about it.
ACL injuries are severe injuries to the knee, and they can be devastating to folks that are very active and eager to resume their sporting life, but it's not the end of the world.
Injury to the ACL, or anterior cruciate ligament, is most common in pivoting sports such as soccer, basketball, and skiing. According to the American Academy of Orthopedic Surgeons, some 200,000 ACLs are ruptured each year, resulting in about 100,000 reconstructions.
Typically, after someone tears their ACL, they develop swelling in their knee, and this swelling results in a loss of motion in their knee, as well as a loss of strength in their thigh muscles.
Treatment options include doing nothing or treating the pain with medications or injections. But for most who want to regain the strength and stability of their knee, and especially for those who want to return to sports, surgery to reconstruct the ACL using another ligament is usually necessary.
What we use is either a graft taken from your own knee or from a cadaver. If we take a graft from your own knee, we take your hamstring tendons or we take your patellar tendon. Cadaver options are also available and are quite popular. In our clinic, we find that individuals that are younger and more active, they have higher success rates with using grafts that are taken from their own knee. Those that are less active and a bit older may have better success rates with a cadaver graft.
Taylor opted to reconstruct his ACL by using a ligament from his own hamstring. He says the surgery took about an hour, but the rehabilitation has been hard work. 6 months of formal physical therapy, followed by 4 to 5 days a week working in the gym.
I think one of the things I heard from numerous sources, especially Dr. Ramappa, but also everyone else who had had the surgery, was just how important it was to do rehab. I think basically to the point of, the surgeon's work can only be so good if you don't actually do anything to fix it afterwards.
The good news is that most patients do well after ACL surgery and are able to get back to the sports they love at a competitive level.
Anytime you've had a severe knee injury such as an ACL rupture, it's difficult to recover 100%, but we're hoping for 99%.
Taylor is thrilled with his progress and is back enjoying the outdoors.
It feels phenomenal. It feels very good. I skied on it about a month ago, which was about 8 months after surgery, and skied for 3 days straight pretty hard. And if you had asked me if I'd ever had ACL surgery, I would have said no. I've been very pleased with it.